To Run or Not to Run? The Consequences of Eliminating Physical Education Courses from Our Elementary Schools by Allie Huggins. 60 years ago, citizens of America were not concerned with rising rates of obesity. Cardiovascular disease was not the leading cause of death, and most individuals were not anxious about high rates of chronic, and in most cases, preventable disease. Americans were more concerned about the infectious diseases that were so life-threatening at the time. However, as we near the end of the year 2011, we are finding that the rates of chronic and preventable diseases are rapidly increasing. And the diseases that were once not behavior change provoking issues are now threatening the lives of our adults and even our children. Preventable diseases are killing our country. This statement may seem harsh, but it has slowly become the reality that we live in. Due to the rapid increase in individuals in America diagnosed with obesity, heart disease, and other preventable disorders each year, we are forced to ask ourselves the question, what can we do differently to see to it that these rates do not continue to increase? If we want to see change in the growing rates of preventable disease, we must take action. It is imperative that the adults are made aware of the obesity epidemic and rising rates of heart disease, as well as the measures necessary to implement change. However, we must take into consideration that poor health decisions are also negatively affecting the youth of America, as rates of obesity and heart disease are rapidly increasing in children. Where does change begin in the lives of our children? Change begins at home, but change also begins in the public schools, where children spend a majority of their time. Diet and exercise are extremely important to take into consideration when working towards change. This policy brief, however, focuses on the importance of providing exercise education for children in the public schools of our nation. What can we do? It should be required that students must participate in 2 years of health education courses over the 3 years that they are in middle school. It is crucial that the preteens and teens of our country are offered health education courses throughout the years of middle school, grades 6, 7, and 8. Some form of exercise education should be part of the curriculum for at least 2 of these 3 grades. According to the American Academy of Family Physicians, well-designed education programs for students should be included in public school curriculum to improve the lifestyle of people who may not know better than previous and sometimes irresponsible behavior patterns. The AAFP argues that students should be offered a chance to gain understanding of their growth and development from conception to adulthood. Through this understanding, teens are provided with a better understanding of what they can do to make better decisions in terms of their health and well-being. Middle school is a crucial transitioning time for kids exiting elementary school and eagerly awaiting the start of high school. At this age, kids begin to make decisions on their own and sometimes without the input of their parents. What better time than these 3 fundamental years to educate kids of and implement in them proper health patterns? Another important question to consider is, in what areas should we focus on educating kids in health education courses? Due to the increasing rates of obesity and heart disease in children and adults, one of the 2 classes should be focused on education of these preventable disorders. The other class should be dedicated to actual exercise and diet planning. Students should have the opportunity to develop skills in decision-making, life planning, and social responsibility. However, before we consider ways to implement change, we must consider the facts. First, we must take into account the diseases that are threatening the lives of our children and adults in this nation. According to the National Obesity Trends from the National Health and Examination Survey of the Centers for Disease Control and Prevention, approximately 1/3 of U.S. adults are considered obese. Furthermore, 12.5 billion children ages 2 to 19 are considered obese. Obesity is calculated by BMI, weight in kilograms divided by height in meters squared. According to Screening and Management of Obesity and Overweight in Adults, there are 3 subcategories to identify obesity. Class 1 has a BMI of 30 to 34.9 kilograms per meter squared. Class 2 has a BMI of 35 to 39.9 kilograms per meter squared. And Class 3 has a BMI of greater than or equal to 40 kilograms per meter squared. The National Center for Health Statistics provides us with further information about the epidemic of obesity in America. The prevalence of obesity in children ages 2 to 5 has risen from 7% between the years of 1988 and 1994 to 10% between the years of 2007 through 2008. It is alarming that children ages 2 to 5 can already be diagnosed with obesity. The prevalence continues to rise in children ages 6 to 11 from 11% to 20%. Rates of adolescents ages 12 to 19 have risen from 11% to 18%. It is alarming that these are the rates for children and young adults, who most of the time are under parents' care and choose their health behaviors based on health behaviors around them. Obesity is such a dangerous disease because it can be linked to so many other diseases that also threaten the lives of our children, such as cardiovascular disease, the leading cause of death in America today. In the case of the Wisconsin Education Association Council, due to the recent budget cuts in schools, health and physical education classes are the first to be cut from the public school curriculum. Why would we eliminate classes that are keeping our kids active and healthy when rates of obesity and other preventable disorders among students are steadily rising? We should be doing everything we can to see to it that children are being informed of proper health behaviors as well as being provided with opportunities to practice those health patterns. Change starts in the schools since kids spend so much of their time there. As long as we sit back and do nothing to provide students with better understanding of the risk associated with not exercising, rates of preventable disease such as obesity and heart disease will continue to rise and affect the younger generation. It is important that we do not ignore the alarming rates of obesity that affect individuals of our country. Furthermore, we must take action to change the increasing rates of preventable disease in children. It is important to implement change beginning with the younger generation, and a great place to start is in the public schools, where educating our students of the importance of exercise and healthy diet is crucial. Thank you.